Sandra Neal. I wanted to introduce my audience, my mom Tina.
Hello.
And my sister Christina. In 1995 through 1998, a public health citizens research group conducted a study entitled Cesarean Fact Sheet that estimates over one-half of cesareans performed in a single year were unnecessary and resulted in 25,000 serious infections. I've seen firsthand the effects that premature labor can cause. Mothers who didn't want to wait. This in turn means more C-sections, premature babies, and in some serious cases, bacterial infections. Today I would like to talk to you about the effects of the common drug given during birth and how it can affect you or your infant in a negative way. In 2013, a story entitled Epidural Anesthesiologist stated that according to the American Pregnancy Association, receiving an epidural can make pushing more difficult and further methods will be taken into action. That means forceps, vacuums, or the drug Pitocin, which is the 0 to 60 drug. Epidurals are the most common used drug during birth, a form of pain relief given to the patients through an IV that a medical anesthesiologist puts directly into the back of the spinal cord. Remember that this method is not 100% pain-free. It basically numbs the feeling, so that in turn means you can't feel your progress, causing health issues like hemorrhaging. Also, a contraction can only last 90 seconds. You would basically be causing pain to you and your baby for 90 seconds. Alright, I'm going to go ahead and make a stopwatch and show you how much time that 90 seconds duration would last. So I'm just going to go ahead and start that, and I'll continue talking. Alright. According to the registered nurse Judith Loham and her entry entitled Why Natural Childbirth, she explains that moms opt for this drug because they are scared of the pain caused by childbirth. But pain equals progress. The closer you get to the end, the more intense the pain will be, but that also becomes your motivation. Learning about what to expect with pain will help you feel more prepared and about the laboring process. Taking a class with a licensed doula or midwife will help ease your fears. That's exactly what I did. I learned about many pain management and causes and the effects, and I felt better knowing for centuries that women have been doing this naturally with no hospital and no drugs. Do you think that they had epidurals in the Stone Age? No. What about Africa? No way. As we learn more about pain management, let's look at what could happen if you didn't go natural and ended up laying on a surgery table because the baby wasn't progressing into the birthing canal. See, we're already at the times right there. So that little duration that I talked was the contraction, which really isn't that big of a deal. Alright, so one day after, let me pull that up right here. One day after surgery, you will have multiple staples below your waistline. And in our demonstration right here, you can see that. One day after, you're going to have a little bitty incision right here, but you're going to have about 10 to 12 staples right along here, okay? And then only a year after, you can tell that the incision is cleared up, but you still have a very bulging, very noticeable line right there that's always going to be there. Okay? So with that said, with those multiple staples along your waistline, imagine a couple days after trying to do laundry, cleaning, anything like that with those staples in there. Do you think that you could really do that? Probably not. In 2013, Baby Center LLC posted a story entitled Recovering from Cesarean Delivery, where they informed us that recovery time is measured in weeks, not in days. So this means that you will need help caring for you and the baby. So that also means less bonding time, one-on-one with you and the baby. And that also means that you're going to be having someone taking care of you and the babies. So you're going to to have to find someone, like a family member, to stay with you for weeks on weeks after. So after 1 year, your body eventually heals back, like the illustration right here, but not without a constant reminder of the huge scar across your gene line. Now with that visual in your mind and facts about pain management, let's put this all back into perspective. Without any drugs, many women have gone natural for centuries. Contractions can only last 90 seconds tops. Moms let fear take over and opt for the epidural, causing health problems for themselves and their babies. Picture just giving birth and nurses rushing your baby into the incubator. Losing that bonding time, how would you feel then? Also, that nasty scar left behind memories of your abdominal surgery that you just had gone through. And that's it.